The top stories tonight in Y News. The Department of Budget and Management has already released to the Department of Health the Special Allotment Release Order or SARO amounting to 311 million pesos.
The Department of Health vows to investigate possible mafia behind purchase of overstocked expired and near-expiry medicines.
Local government units in Metro Manila to ramp up their cash aid distribution as DILG extends its deadline.
Private hospitals are facing challenges putting up step-down facilities.
U.S. President Joe Biden decided not to extend the August 31 evacuation deadline of the remaining American soldiers in Afghanistan.
And thousands of firefighters struggle to battle the flames from the Caldor fire in California.
Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Wednesday, August 25, 2021. I am Harleen Delgado. Join us in the next hour as we deliver today's top stories around the country and in other parts of the world.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. Health Secretary Francisco Duque III has asked lawmakers to pass a bill that will enable all healthcare workers to receive special risk allowance. Meanwhile, some 20,000 healthcare workers are now in the process of receiving their unpaid SRA. Ray Pelayo reports.
The Department of Budget and Management has already released to the Department of Health the Special Allotment Release Order or SARO amounting to 311 million pesos. This will be used for the distribution of special risk allowance to over 20,000 healthcare workers who have yet to receive their benefits.
It's already been released, I am told. So we will already download this to the regions and to the hospitals.
Ang aking tingin dito, ito ay ibibigay doon sa mga hindi nakatanggap na directly affected na na mga healthcare workers. Yun muna ang uunahin. Pagkatapos yung expansion niyan, kung hindi pa namin alam kung magkano talaga. Ang DOH ang magbibigay sa amin ng listahan, magkano kung sakasakaling bibigyan ito, ano ang magnitude at saka ilan itong mga healthcare workers na to.
This is a welcome development for Philippine Nurses Association, but they are hoping that all health workers be given these benefits. The group also noted that there are other benefits are not yet distributed to them.
Hindi rin lang yan SRA meron pa tayong meal accommodation transportation na may nagpasa sa atin ng guidelines nila na it's 2,200 per day. So sobrang 'di ba, parang paano ba nila ibibigay yan?
Health Secretary Francisco Duque III meanwhile urged the lawmakers to pass a bill that will enable to expand the provision of SRA even to health workers who are not yet directly handling COVID-19 patients.
Gusto ko po talaga. Gusto ko na ibigay lahat ng pwedeng ibigay kung may pondo. Ang problema lang po talaga ay baka naman sigurado ako makukuha.
Secretary Duque has already asked the DOH Technical Advisory Group of experts to prepare several inputs which Congress may consider in crafting a law for the expansion of the SRA provision. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The House Committee on Appropriations is doubtful that the proposed 5.024 trillion peso 2022 national budget of the Duterte administration is enough for the recovery of the Philippine economy. Nel Maribuhok will tell us why.
House Committee on Appropriations Chairperson Representative Eric Yap believes the government needs more budget to invest in infrastructure projects to create jobs for workers displaced by the pandemic. The present administration also need to set aside funds for cash assistance to families and small business who suffered the most from the effects of COVID-19.
Yes, sir. Not enough. Dapat nga sana yan 10 trillion. But the question is, do we have that money? Yung 5 trillion lang, sir, talagang kulang na eh. Kumbaga, hinahanap na rin ng mga economic team kung saan kukunin yung pera and saan mangungutang pa. Kung dadagdagan pa natin yan, I think hindi na rin natin kayang dagdagan pa yung 5 trillion. So, we have to pagtiyagaan natin dapat muna siguro yung 5 trillion na dapat magastos sa tama.
Ibon Foundation earlier said that the 2022 proposed budget will just stall the recovery and worsen inequality. But despite this observation, the committee assures that they will carefully scrutinize the proposed funding of each government agency. This includes the 28.1 billion peso budget of National Task Force to End Local Communist Armed Conflict or NTF-ELCAC.
Kaya po tayo magkakaroon ng deliberation, might as well the agency should justify. Kasi kung hindi nila ma-justify sa amin yung needs kung bakit ganyang kalaki ang ELCAC and ba't ganyang kalaki ang confidential fund, we will slash it and dadalhin namin kung saan namin nakikita mas kailangan ng mga Pilipino yung budget.
Meanwhile, House Committee on Economic Affairs Chairperson Congresswoman Sharon Garin thinks that government spending is an important contribution for economic growth.
Whether that's for COVID or infrastructure or whatever, basta gumastos lang ang gobyerno, ang effect dun sa ekonomiya is may domino effect talaga yan. It will statistically it will affect talaga yung growth that.
The House of Representatives will start tomorrow the deliberation of the 5.024 trillion peso 2022 proposed budget. Early this month, the administration's economic managers trimmed their growth projection for 2021. From 6 to 7% growth assumption, they revised it to 4 to 5% in light of the reimposition of stricter mobility restrictions in various areas. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health will investigate the possible mafia behind the recurring problem of the agency in procuring overstocked and near-expiry medicines. This report will tell us why. In the resumption of the Senate Blue Ribbon Committee's hearing on the deficiencies found by the Commission on Audit on the Health Department's use of COVID-19 funds, Senator Panfilo Lacson believes there is a syndicate behind the purchase of over 2.7 billion pesos worth of overstocked and near-expiry medicines over the years.
Ang ini-indicate sa akin ito is probably merong mafia na well-entrenched na hindi nabubuwag unless the secretary or the leadership of the DOH will really put his foot down and do something about this, hindi matatapos itong overstocking ng gamot. Nag-commit po kayo ng 2018, February 7, when you faced us in the Commission on Appointments. Pero 2019, lumobo, naging 2.2 billion.
Health Secretary Francisco Duque III explains that they follow standards in purchasing medicines. Despite this, the health chief says they are instituting reforms in their supply management to address the problem.
Hindi ka pwedeng bumili ng mga near-expiry na drugs and medicines. So siguro yung near-expiry dito po na nakikita natin, baka hindi lang siya gumalaw kaagad at lumapit na doon sa kanyang expiration. Magpapaimbestiga po ako nito. Lalo na yung sinabi ninyo na yung may mafia.
Lacson also flagged the purchase of face shields of the procurement service of the Department of Budget and Management, saying that it was not included in the list of common use supplies and equipment. Meanwhile, former Budget Undersecretary Lloyd Christopher Lau defended before the committee the purchase of face masks, which senators believe as overpriced.
We were able to procure it at 13.50, and when the economy was very strong and we had sufficient supply already, we were able to procure it at 1 peso and 49 cents.
Senate Blue Ribbon Committee Chairperson Richard Gordon has ordered Lau and the DBM to submit to the committee all the bidding contracts and documents of the procurements made by the agency for COVID-19 response. Meanwhile, Gordon also called out Duque for his habit of asking his undersecretaries to answer some of the inquiries of the senators.
Secretary Duque, I respect you, no? But please, you don't pass it on. You have to man up and answer the question yourself because that shows weakness. Kaya ka napagdududahan dahil hindi ka sumasagot forthrightly. And I don't think that is your intention. Pero sagutin nyo kaagad.
The Senate Blue Ribbon Committee will resume its hearing on Friday, August 27. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
In other news, presidential daughter and Davao City Mayor Sara Duterte Carpio breaks her silence on the Go-Duterte tandem in the 2022 elections. She also has a message for her father and his former aide. Rosa Dicos has the story.
Davao City Mayor Sara Duterte Carpio revealed that his father, President Rodrigo Duterte, personally confirmed to her that he will be running for vice president in the coming election with Senator Christopher Bongo as his president. The presidential daughter also disclosed that she recently received 2 letters with the endorsement of the president. This contains 2 options or considerations for the 2022 national elections. The first note has an explanation why she should endorse the Go-Duterte tandem, while the second suggested that she take Senator Go as her vice president. Duterte Carpio then suggests to her father and the senator to own up publicly their decision. The presidential daughter also advised them to stop talking about her and make her the reason for them running or not. They should also instead present to the people what they can offer to the country and how they can help our fellow Filipinos. She adds she is not a last 2 minutes person and she refuses to be a political punching bag for a political party. But President Duterte said he will step aside if his daughter decides to run for president.
Kinukumpirma ko po yan na nanggaling yan sa bibig ng presidente. To be more exact, ang sabi niya, kung tatakbo si Mayor Sara, Bong is out. Ako naman, dahil sa delikadeza, hindi po pwedeng dalawang Duterte ang tatakbo. So if Sara runs, then she will have to choose her own vice president. Yan po ang mga binitawang salita kahapon ng ating presidente.
Ang narinig ko lamang po si Pangulong Duterte na sinabi niya po na pag tumakbo si Mayor Inday Sara pag presidente, ang sinabi niya po ay hindi siya tutuloy, no? As it stands, no? Sa kanyang pag-isip.
Despite the controversies, PDP Laban will proceed with their plans to formally nominate President Duterte as vice presidential contender and Senator Bongo as presidential candidate. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the National Union of People's Lawyers warns that several groups and individuals will seek for President Rodrigo Duterte's disqualification once he files his candidacy for vice presidency in the coming national elections. Dante Amento tells us why.
National Union of People's Lawyers President Nery Colmenares says that it is unconstitutional for President Rodrigo Duterte to run in coming elections. Colmenares made reference to Article 7, Section 4 of the 1987 Constitution, which states that an elected president shall not be eligible for any re-election after his 6-year term.
Kami ay isa sa magcha-challenge doon sa pagtakbo ni President Duterte. May mga ibang lawyers din ako narinig na public yung nagsabing hahabol siya. If I remember right, I think Christian Monsod is saying, if no one will file a case against him, I will file a case.
But political analyst Ramon Casiple, on the other hand, opposed Colmenares' legal point of view.
Walang basehan ng Supreme Court na gumawa ng ganung tipo ng desisyon. Dahil ang basehan nila konstitusyon eh. Wala sa konstitusyon na nakasabi na bawal yun.
This observation was also supported by Justice Secretary Minardo Guevara. Secretary Guevara argued that the Constitution does not prohibit an incumbent president from running for vice president in the succeeding election. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. The Department of the Interior and Local Government extends the deadline of cash aid dispersed distribution until August 31. JP Nunez will tell us why live. Yes, JP, good evening. What is the effort that LGUs will do to ramp up their distribution in order to meet the deadlines?
Yes, William, good evening. Muntinlupa City says they are now planning to restructure their system of distribution to finish it until the August 31 deadline. Vice Mayor Artemio Simundak says they will meet with the local officials tomorrow to discuss measures on how to intensify their efforts.
Yun nga ang in-announce ng government na 50% pa lang yun. Pero i-double time nila para ang ayuda ay ma-distribute. Pero sa ngayon, magkakaroon na naman ng bagong order si Mayor para mapabilis ang ayuda.
However, a barangay captain in the city explains they experienced delay in giving out the financial aid due to new system of online distribution.
First and foremost, wala po sa barangay kupang ang pera na kailangan ibigay sa tao. Actually, hindi rin namin malaman kasi for now, parang nire-reconstruct pa ni City Council yung magiging setup na bago. Wherein dati naman cash to cash per barangay.
DILG Secretary Eduardo Año said they decided to extend the deadline for cash assistance until August 31 because some cities has yet to finish their distribution.
Atin pong ini-extend ang deadline ng pamamahagi hanggang August 31, 2021 para makapagbigay pa ng tamang panahon sa pamamahagi. At yung mga iba po na claimants na hindi po nag-a-appear ay magkaroon ng adjustment naman yung ating mga LGU para sa mga waitlisted na nag-appeal at mabigyan din po ng.
Meanwhile, William, only Caloocan City and Pateros were able to finish cash aid distribution as of now, while Mandaluyong is expected to finish it tomorrow, while other cities such as Valenzuela and Las Piñas, which have distributed 50% of their cash and aid funds, have yet to give statements. That is our latest live. Back to you, William.
Yes, thank you, JP Nunez reporting live. Meanwhile, World Health Organization Western Pacific region is pleased with the Philippine government's vaccine rollout. However, he advises the government to speed up their efforts to combat the effects of the more transmissible Delta variant. Aiko Miguel has this story.
The government has to reach out to the more vulnerable sector and convince them to have their COVID-19 shot. This was the recommendation of the World Health Organization Western Pacific region amid the threat of the more transmissible Delta variant.
But what countries would need to do is to speed up and scale up the vaccination so that we could cover the priority population as soon as possible. And to, as much as possible, be ahead before the Delta variant is going to spread. We are urging countries to go to the last mile of vaccinating your healthcare workers and your elderly. For example, in the Philippines, if we are saying that 95% of the healthcare workers are already vaccinated, when Delta variant is spreading, let's find out who are those 5% that are remaining and let us get.
Dr. Escalante also recommends to inoculate younger population when there is sufficient supply of COVID-19 vaccines. Of the 37 countries in the Western Pacific region, the Philippines recorded the highest COVID-19 cases in 24 hours, followed by Japan, Malaysia, and Vietnam. According to WHO WPR Regional Director Dr. Takeshi Kasai, they have also been seeing more clusters of Delta variant infection in households.
The Delta variant is now a real threat, which is testing the capacity of even the strongest public health system in our region. Delta's higher transmissibility means cluster of cases are quickly leading to bigger outbreaks, especially in the high-risk setting known as the 3 Cs, closed space, crowded places, and close contact settings. We are also seeing more clusters in the families. Once the virus enters the household, more family members are quickly becoming infected.
Dr. Kasay also urged the Philippine government to ensure they have enough number of healthcare workers as COVID-19 cases prominently rise with the existence of Delta COVID-19 variant.
So the Philippines is one of the countries in the regions facing this surge. And it is not only in the capital, but multiple provinces experiencing surge. We call it the pulse. And in some places, they are experiencing, the hospitals are overwhelmed. And then what I also wanted to share is that we heard that the healthcare workers are all really exhausted.
WHO also reiterated that lockdowns are no longer effective to curb COVID-19 infection, but the virus can be prevented through strict adherence of minimum public health standards, PDITR strategy, and vaccination. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Confinement due to COVID-19. Despite being considered as recovered, Dumagoso still has to be isolated for more or less 3 days. Caloocan City Mayor Oscar Malapitan announced today that he tested positive for COVID-19. Nevertheless, he vowed to continue to attend to his duties while on isolation. The mayor also encouraged his close contacts to go on self-quarantine and undergo COVID-19 testing. Meanwhile, Vice President Leni Robredo has gone on quarantine. This after being exposed to somebody who is infected with the virus. She will submit herself to an RT-PCR testing on Monday, which is the last day after her exposure. Because of this incident, the Vice President apologized for she needs to cancel her activities and prior commitments. Metro Manila mayors are optimistic to fully vaccinate half of the target population by the end of next week. This is given the current vaccination rate in the capital. Marvin Calas reports.
Aside from a stable supply of COVID-19 vaccines, the Metro Manila mayors also aims to further expand the vaccination sites and add more healthcare workers to speed up the vaccination rollout. At the end of the month, the Metro Manila mayors aims to meet fully vaccinating half of the region's eligible population. Metropolitan Manila Development Authority Chairman Benhur Abalos says, as of now, over 75% of the eligible population of NCR are vaccinated with first dose, or equivalent to more than 7.4 million individuals.
Once mag-second dose po yan, napakarami nitong grupong ito. No? At siguro anytime na po yung second dose na yan. Basta pumasok po ang 2 doses nito, kayang-kayang pong mahit po yun. Kamukha sa Mandaluyong, bukas puro second dose, maramihan to. So basta mapakunahan yung puro second dose na yun, puro fully protected. No? At sa Kalakang Maynila. Kaya yun po ang ano po nitong mga bakune. Akala natin mabagal, pero sa totoo lang nag-aantay.
Nevertheless, Chairman Abalos explains that although it is expected to attain a good vaccination turnout where majority of the population gets fully vaccinated, granular lockdowns will still be implemented.
Sana maunawaan ng tao dahil maski na tayo completely na bakunado, hindi natin maiiwasan talagang tatamaan pa rin. No? At ito'y napapakita sa ibang bansa. Ang problema, maski asymptomatic ka, baka makahawa ka. At baka mamaya mahawahan mo yung mga walang bakuna, kawawa naman sila.
The official added that the implementation of granular lockdown within NCR will prevent the overwhelming of all hospital intensive care units within the region. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health asked hospitals to put up step-down COVID-19 facilities to optimize bed utilization, but some private hospitals face challenges in putting up such facility. Asher Kadapan Jr. tells us why.
The Private Hospitals Association of the Philippines says they have been providing step-down facilities, transferring recuperating COVID-19 patients from COVID wards to a non-COVID room after about 10 days of infection. But PAPI President Dr. Rene De Grano explains that as much as they would like to put up more facilities, they were refrained from doing so due to constraints in the number of healthcare workers.
Pag nagkaroon pa ng, halimbawa, may isang mahawa, right now nangyayari may isang mahawa, yung mga kasama niya, ikukuarantin lahat yon. Kung 5 sila, yung 5 yun, Kung hindi man mag-positive yung iba, kailangan mo pa rin i-quarantine for at least 7 to 10 days.
The group of hospitals explains this as the Department of Health asks hospitals to provide such facility. DOH spokesperson Undersecretary Maria Rosario Vergara explains that this aims to ease the overwhelming number of COVID-19 patients in hospitals and optimize COVID bed utilization.
Pinadadagdagan po natin ang mga ICU, pinapadecongest natin ang mga ospital dito sa mga mild at asymptomatic at ililipat po sila sa mga step-down facilities. Hindi naman po para tanggihan ng kahit na sinong pasyente sa ating mga ospital, i-redirect lang po sila. That's why we are asking local governments and also our hospital facilities to have a navigation system.
As of now, 3 quarantine sites in Metro Manila were converted to step-down facilities as cases surged in March this year. These include Rizal Memorial Coliseum and Ninoy Aquino Stadium in the city of Manila and Quezon Institute in Quezon City. The facilities can accommodate a total of about 300 patients. Other step-down facilities were also opened in Pasig City, Lung Center of the Philippines, Bulacan, and Tuguegarao City. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines today recorded 13,573 new cases of COVID-19, pushing the total number of confirmed cases to 1,883,088. The Department of Health, or DOH, said the latest tally brought the country's active cases to 125,378. Of these cases, 95.9% are mild, 1.3% are asymptomatic, 0.94% are moderate, 1.2% are severe, and 0.6% are in critical condition. The latest figure does not include data from 7 testing laboratories that failed to submit data on time. Meanwhile, total number of recoveries has risen to 1,725,218 after 15,820 more patients recuperated from the viral disease. Death toll from COVID-19 has climbed to 32,492 with the addition of 228 new fatalities. Meanwhile, the current global caseload and death toll stood at 213,301,298 and 4,454,812 respectively, according to the Johns Hopkins University. The U.S. is the worst hit country with the world's highest number of cases at 38,777,523 and 630,838 deaths, followed by India and Brazil. For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
Workers from Afghanistan arrived in the country. They arrived at the Ninoy Aquino International Airport around 11 a.m. aboard a Philippine Airlines flight from London. Yesterday, 16 OFWs evacuated from the war-torn country came home last night and landed at the Clark International Airport. As of today, a total of 183 Filipinos have fled Afghanistan after Taliban forces seized power last week. 16 other Filipinos are requesting for repatriation, while 10 have chosen to stay. The Philippine government ordered mandatory evacuation as tension continues to escalate.
And for the news abroad, U.S. President Joe Biden decided not to extend the August 31 evacuation deadline of the remaining American soldiers in Afghanistan. Paul Gatchalian will tell us why live. Yes, Paul, please go ahead.
Mariel, U.S. President Joe Biden said that each day American troops are in Afghanistan bring added risk. The American chief executive expresses concern at the White House regarding the growing danger each day, referring to the possibilities of ISIS-K targeting the airport.
We agreed that we will continue to our close cooperation to get people out as efficiently and safely as possible. We are currently on a pace to finish by August the 31st. The sooner we can finish, the better. Each day of operations brings added risk to our troops. But the completion by August 31st depends upon the Taliban continuing to cooperate and allow access to the airport for those who were transporting out.
Since August 14, 70,700 people have been evacuated, as well as 4,000 American passport holders. The Pentagon officials are confident that all Americans will be out of Afghanistan by next Tuesday. However, there are still thousands of unknown foreigners in the country attempting to get out. Up to this day, all air traffic occurring in Kabul airport is being controlled by the U.S. military, but the Taliban will readily take over once they have pulled out. The Taliban have also made it clear that after the 31st of August, no more Afghanistan citizens will be able to access the airport, preventing them from leaving through evacuation flights. Mariel?
Thank you, Paul Gatchalian, reporting live. A U.S. study found that around 25% of Los Angeles residents who caught the coronavirus from May to July this year were fully vaccinated. Maeve and Dog will tell us why live. Yes, Maeve, good evening.
Good evening, Marielle. The emergence of the highly infectious Delta variant was found to have decreased the efficacy of vaccines in recent months. The data published in the U.S. Centers for Disease Control and Prevention's weekly report on Tuesday revealed that among 43,000 infected residents in Los Angeles, aged 16 and older, 10,895 were fully vaccinated. Further to the Los Angeles study, the CDC also reported a drop in vaccine effectiveness among frontline workers, from 91% before the arrival of the Delta variant to only 66% after. The study is part of a plan by the CDC to determine whether Americans need a booster shot to increase protection against the virus. The study, however, also showed that the vaccine did provide protection against more severe cases, with only a small percentage of those fully vaccinated being hospitalized, admitted to an intensive care unit, or placed on a ventilator. Back to you, Marielle.
Thank you, Maeve and Dog, for that live report. Thousands of firefighters struggle to battle the flames from the Calder fire in California. Ia De Vera will tell us why live. Yes, Ia, please go ahead.
Marielle, the Calder fire burning in El Dorado County continues to push towards Lake Tahoe, where resort communities are situated. As it threatens over 17,000 structures, the California Fire Protection is fighting nonstop to contain the blaze. According to Tom Porter, director of the California Department of Forestry and Fire Protection, they are putting all efforts and resources to contain this disaster. Moreover, the U.S. Forest Service officials have ordered the closure of 9 national forests in Northern California. It now covers more than 117,000 acres and destroyed over 630 structures. The air quality around Lake Tahoe is now the worst in the nation, with an air quality index above 500. Meanwhile, California is only halfway through its fire season, with 12 different wildfires across the state, and nearly 43,000 residents are under evacuation orders. Back to you, Marielle.
Thank you, Ia De Vera, reporting live. And those are the reasons behind the news in other parts of the globe. I am Mariel Latoza, reporting live from Perth, Australia. Good evening.
It has been difficult for some of our fellow Filipinos to earn a living in this time of pandemic after losing their bread and butter. Now, some households have a wish come true, as Wish 1075 granted their wish for a new livelihood.
4.5 million. This is the number of Filipinos who lost their jobs in 2020. With COVID's crippling impact on various economic sectors, making ends meet has become tougher for many of us. Living at the Baseco compound in Manila, Rochelle is a dedicated housewife and a mother of 3. Their family's main source of income is the housekeeping work of her husband, John Paul, at a mall in the city.
Repacker po ako, tapos habang nagre-repack po ako, nag-online din po ako ng mga damit. Nahinto lang po nung nagka-pandemic, tapos yung sunod-sunod nagkasakit po yung mga anak ko.
John Paul carries a huge responsibility but the pandemic has made him feel the heavier weight of being his family's provider.
Dati po, nakakakain ng medyo masarap mula nung minsan lang po yung pasok ng asawa ko, ma'am, tapos nalubog na po kami sa mga utang.
To ease her husband's load, Rochelle had to think of a way to augment their daily expenses.
Nagtitinda po ako ng mga street food po, kikiam, french fries, pero hindi pa rin po sapat, kaya minsan 200, 300. Doon na po ako kumukuha ng pambili bigas, minsan ulam, pag medyo malaki-laki po yung kita.
Like Rochelle and her husband, James, 50, finds it difficult to get enough money to survive. Since he lost his job as a security guard, he had to rely on financial aid from government officials and acquaintances to get by.
Ako po ay security guard dati po at nagsasadline po ako sa construction kasi may mga anak po ako. Tapos nung nagsasadline po ako ng construction, ako po ay nagkasakit po ng hernia sa luslos po. Mahirap po kasi paminsan walang-wala talaga kami. Lumalapit ako sa mga konsyal, paminsan lapit ako sa mga kakilala, ibang tao, hingi lang ng tulong para makabigay ng bigas, ulam, saka sa asawa ko kasi may sakit po na high blood. Ang maintenance niya, araw-araw po nangingi ng tulong sa mga tao, kahit saan-saan po. Nakatanggap rin po ako ng 5K, yung sa anak ko naman nakatanggap ng 8K, yung sa ayuda ng gobyerno. Bigay sila ng ayuda nagsimula yung pandemic.
James doesn't only provide for his wife and children, he also has grandchildren that he needs to support. To help shoulder their everyday expenses, his son Rafael started working as a water delivery staff.
Yung April po, kasi po hirap din po dito sa bahay eh. Wala pong trabaho si Papa. Po naaawa rin po sa mga pamangkin ko eh. Minsan naghihingi po sila ng pagkain sa mga nila, sa kaibigan, sa kapitbahay po. Pag kumakain po yung mga kalaro nila, naiinggit po yung pamangkin ko eh. Sa pamangkin ko lang po yung pati sa nanay ko po. Yung nanay ko po naglalabada po din sa kapitbahay po. Para may pagkain po kami. Si Papa po proud po ako sa kanya kasi di naman po ako lalaki ng ganito kung wala po siya. Hindi po siya sumuko eh. Kahit po marami pong nagdaan sa amin, hindi po sumuko yung tatay ko. Si Mama naman po, nakasuporta po siya sa tatay ko kahit sobrang hirap po talaga namin.
Mahirap po, ma'am. Mahirap. Basta sa akin po, hindi lang po ako magnakaw. Makikiusap po sa tao. Hihingi po ako ng tulong.
Though they have different stories of struggle, James and Rochelle have one thing in common: their earnest wish to better provide for their families. And on its 7th anniversary, Wish 1075 became instrumental in turning this into reality. As a help for their everyday life, they received a livelihood showcase comprising a fully equipped mobile kiosk and starting capital worth 7,000 pesos.
Wala po akong mapaglagay sa sobrang saya ko po ngayon. Labis po akong nagpapasalamat po sa lahat sa naipagkaloob po sa akin ngayon sa ganitong sitwasyon ko, kahit na may pandemya. Maraming salamat po talaga. Yun lang po ang masasabi.
Ang masasabi ko po sa Wish 1075, maraming salamat po dahil isa po ako sa nabigyan niyo po ng card. Hindi ko po sukat akalain na ako po ang mabibiyayaan ng ganito. Maraming po salamat po sa inyo.
Ang masasabi ko lang po, kapit lang po talaga at manalangin sa Diyos po. Tuloy lang ang laban. At huwag niyong kalimutan yung nasa taas lang po. Number 1 po.
For these people who have big hearts for their families, having a modest but stable source of income can already go a long way.
before we close, we will leave you with a final word, giving glory to God. From the book of John, chapter 5, verse 14. And it says, "And this is the confidence that we have in him, that if we ask anything according to his will, he heareth us." And those are the reasons behind the news, August 25, 2021. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.
You have to man up and answer the question yourself because that shows weakness. Kaya ka napagdududahan dahil hindi ka sumasagot forthrightly.
It's already been released, I am told. So we will already download this to the regions and to the hospitals.
Ang aking tingin dito, ito ay ibibigay doon sa mga hindi nakatanggap na directly affected na na mga healthcare workers. Yun muna ang uunahin.
Gusto talaga ninyo? O sige. Tatakbo ako ng Vice Presidente.